नमस्कार दोस्तों, गुड इवनिंग, सलाम, सत श्री अकाल। आज एक बार फिर स्वागत है आप सबका डॉक्टर सीमा पांडे टॉक शो नॉलेज शॉट्स। आप सबको 75वें गणतंत्र दिवस की ढेर सारी बधाइयाँ। As a mature republic, now we understand what our duties are apart from our rights. So, we need today, in continuation of the same theme, we are going to talk to our medico fraternity about our understanding of certain basic facts, and to throw much light on that subject, I have a special guest today who is not only working a lot in this field. She is an intelligent, smart, and working as professor in one of the medical college. She'll introduce herself. So before I tell you all about us, I am Dr. Seema Pandey from Azamgarh, Dr. Anuradha Khar, my co-moderated from Bangalore, Dr. Arshi Iqbal from Kota, and Dr. Raj Lakshmi is not here today as she is not feeling well. Welcome, Sheila, on board, and I would like you to introduce yourself to our viewers.
Thank you so much, Seema ma'am. Thank you so much, Anuradha ma'am and Arshi ma'am. As am I in the show?
Yes, you
Yes.
are.
Yes.
Okay. So first and foremost, gratitudes and Jai Hind to everyone as we celebrate 75th Republic Day. It feels, very proud that yesterday I was lucky one to witness our Honorable Prime Minister and President in the live parade of Republic Day, and I'm still thrilled. Regarding me, I am a small person.
Congratulations.
Thank you, thank you. I'm a small person contributing back to the society. I'm just trying that. I am Professor Shaila Jamal. I'm head of the unit and department of OBGY, Rashtriya Medical Research Institute, Bareilly, and I am founder and president of Society of Menstrual Disorders and Hygiene Management, and that's a socio-academic platform where doctors are connected with the community. So during these 5 years since we formulated this society, we have done quite much work, but miles to go before we say that yes, we have achieved something. So and again, gratitudes and regards to Seema ma'am for having me here.
So, Shaila, kudos and well done. Congratulations. And we are proud of you having on this show. And I have been listening a lot about Shehla through other platforms, lot of good things she's been doing. And today, through this platform, I wanted our own fraternity to get aware of these facts. So I'll start with the same sequence, Shehla. Would being a head of department of an obstetric gynecology unit at such a young age but still with lot of experience, I would like to understand what is the understanding of this menstrual hygiene concept which WHO, UNICEF, our government, and lot of private communities they are focusing on, and they are trying to do lot of work. All of sudden in last decade menstrual hygiene has become a very hot topic. And as a medical student, when I remember my days, yeah, we were told that menstrual cycle is of so many days, you bleed and you should be keeping yourself clean, but it wasn't as structured, as SOP based as it is today. So what is your experience when you interact with these students, medical students, and you are working throughout the country? How do you feel?
Thank you, Seema ma'am. Actually, this question was, I saw this coming because when I ventured myself into this topic, मैं आपको बहुत बहुत frankly बताना चाहूंगी कि मेरा भी वही हाल था जो आज majority सभी लोगों का है. हम लोग बस उतर तो गए थे इस फील्ड में कि मेंस्ट्रुअल हाइजीन है क्या, हम भी देख लेंगे, इतने एनजीओज, इतने एनपीओज इतना काम कर रहे हैं तो हम भी कर लेंगे. But then I realized that due to lack of knowledge, due to lack of this structured program, everybody and anybody was a menstrual health educator, right? and gynecologist, we somehow took a back seat in the topic. जो हमारा कोर एरिया है उसके बारे में पता नहीं कौन कौन बातें कर रहा है. जिसका जो मन है, जिसका जो एजुकेशन का लेवल है, वो एजुकेशन इम्पार्ट कर रहा है. So what I realized first and foremost was that the source of information should be very, very authentic. And who is more authentic than a gynecologist herself? तो एक एनजीओ में आपको बहुत आई वाज सरप्राइज्ड, आपको भी शायद सरप्राइज होगा ये सुन के कि मुझसे डायरेक्टली सवाल किया गया कि मैडम, मेडिकल करिकुलम में तो इस टॉपिक को डिस्कस ही नहीं करते हैं, आपको क्या पता होगा इस बारे में, हम आपको बताएंगे. एंड दैट वाज इन अ वेरी बिग समिट. एवरीवन वाज देयर, बहुत एनजीओस के हेड्स थे, बहुत सारे लोग थे, वेरी मेनी पावरफुल एंड पॉलिसी मेकर पीपल वर देयर. सो आई सेड कि मुझे हाइजीन एज अ कोर सब्जेक्ट तो हमें पढ़ने की जरूरत भी नहीं है, because we understand that these are the basics which every one of us are following. Second thing that I want to emphasize on this important platform also कि ये थोड़ा सा hyped भी है, right? अगर हाइजीन से इतना ही पुअर हाइजीन से प्रॉब्लम होती तो मैम आपकी, मेरी, अनुराधा मैम की और अर्शी मैम की ओपीडी में यही पेशेंट्स होते. हम और कुछ देख ही नहीं रहे होते अगर ये इतना बड़ा एक वो होता. आई डू बिलीव कि इसमें बहुत प्रॉब्लम है. आई डू बिलीव कि बिकॉज वी शुड बी थैंकफुल टू दीज एनजीओज एंड एनपीओज कि इनकी वजह से इस एक टॉपिक पे बात करने लगे हैं. आई डू बिलीव कि इसमें बहुत सारे अब men are also involved, but I also feel that now along with so many MMMMs, money is also involved. So things are taken to a different direction. And coming back to the point कि structured program ना होने की वजह से हमारी understanding of this subject is no less. We are still very powerful. We are still the most authentic and the correct and verified source of information as far as menstruation, its physiology and pathology is concerned. But hygiene के लिए हम और आप बहुत, I don't think मेरे से कोई differ करेगा. I would like to have your opinion also कि hygiene में है क्या? सिर्फ नहाना धोना, पैड्स को सही टाइम पर चेंज करना. तो वहां पर बात नहीं हुई थी. बात वहां हुई थी जब इसको एक अनडिग्निफाइड वे में प्रेजेंट किया गया था कि मेंस्ट्रुएशन होना शेमफुल है, मेंस्ट्रुएशन के बारे में बात करना गलत है, इसको छुपा के रखना चाहिए. सो दोज वर द प्रॉब्लमैटिक थिंग्स. एंड ड्यूरिंग दिस डेकेड पीपल हैव सीन चेंजेस कमिंग आउट एंड दे आर पॉजिटिव चेंजेस.
So that is a very, very correct description of what is going on. It is hope with hype. And in this era of consumerism, where every bit and everything is being like involved to increase the consumerism, menstrual hygiene is not an exception. Mm, for us, menstrual hygiene is not about what kind of pad you are using, what kind of clothes you are wearing, or what kind of products you are using on your body. If I talk about menstrual cycle, even if I think and I go to teach these girls in school about menstrual hygiene, it's about knowing their menstrual cycle, following it properly, using it in their day to day life. For example, I'll give you a very stupid example of myself. I have been taught everything about, all of us have been taught everything about menstrual cycle, say period. But as a person, as an individual, I could not use it in my own personal life when it came to my own life. I never thought about it. This thought never occurred that this same period should be used in my own life too. Because we have taken it as a subject. We were also young and we took it as other kids are taking. So that was the reason I wanted to raise this subject about menstrual hygiene and total menstruation and its implications, other things, what are related to it. And there was no other person better than Dr. Shaila Jamal to talk about it. So, Shaila, I just want to know through your platform, what are the things you are telling people which are different as a medico?
आई लव यू फॉर दिस मैम, बिकॉज आई वॉन्टेड टू टॉक अबाउट दिस. जैसे मैंने भी कहा कि मेंस्ट्रुअल हेल्थ हाइजीन के बारे में बात हो रही थी, बट कहीं पे भी कोई एविडेंस बेस्ड रिसर्च नहीं थी. आप अभी देखें तो बहुत सारे, आई एम सो सॉरी टू से, गायनेकोलॉजिस्ट को भी प्रॉपरली अगर हम पूछे कि मेंस्ट्रुअल कप्स क्या है, उसकी लॉन्ग टर्म शॉर्ट टर्म जो टर्म इम्प्लीकेशंस है वो क्या है, बहुत सारे सवाल फिर हम लोग चुप हो जाते हैं, एंड देयर इज व्हेन दीज पीपल आर टेकिंग एडवांटेज। सो मैंने जो नया किया है, और मैंने अकेले नहीं किया, बहुत सारे लोग हैं, पहला है कि क्वांटिफाई किया मेंस्ट्रुअल हाइजीन, किसी के लिए पैड्स की अवेलेबिलिटी ना होना है, किसी के लिए उसके बारे में बात करना ना होना है, किसी के लिए डिसमेनोरिया के बारे में बताना ना पाना है, किसी के लिए हैवी मेंस्ट्रुअल ब्लीडिंग है। सो व्हाट इज एक्चुअली जो आपने कहा ना, एक कॉम्प्रिहेंसिव मेंस्ट्रुअल हेल्थ का कॉन्सेप्ट है, वो हमने बिल्डअप किया है। सो कॉम्प्रिहेंसिव मेंस्ट्रुअल हेल्थ के लिए मैंने लगभग 8,000 लड़कियों में एक स्टडी की, और उसको जो ये प्रॉब्लम है उसको क्वांटिफाई करने की कोशिश की, और एक मेंस्ट्रुअल हेल्थ इंडेक्स बनाया। Menstrual health index एक total component है. Thank you, ma'am. And I think it's a very useful tool.
Dr.
UNICEF is
Shella,
also going to adopt it. Yes, ma'am.
Dr. Shella,
जी ma'am.
your program is being viewed in South India, and we have a bit of problem with Hindi. So could you mix in the English
Okay.
if you want? Sorry,
Yes, yes.
because a
Total
lot of
English.
my friends here in Bangalore are watching. Sorry.
Okay. So we have developed a menstrual health index. That's a comprehensive and validated and very, very objective tool. It's not subjective. It's not your perception. It's not my perception. It's actually science based knowledge of the problem. So it includes four components. One is menstrual cycle component, and that we all gynecologists know what we have to look. Second is sanitation component. Sanitation component includes availability of pads, usage of other sustainable menstrual options. Probably we are going to talk about it later on. Third component is psychosocial component, that is the social implication of menstruation on a female's life. And fourth is wash component. A wash, we all know, it is water and sanitation and hygiene associated with menstruation. After we give a score to all these four components, we calculate composite menstrual health index that gives us one, the value. If it is poor, then yes, the menstrual health and hygiene of that particular area or that individual is poor. Second, when you want to look what is poor, her menstrual cycle is perfectly normal, but she is not having sanitation access. Her menstrual cycle is perfectly normal, but her wash component is deteriorated. Or every three things are good, but she's having, she feels shameful about talking in menstruation. She limits her activities, she skips her school. So that comes into the fourth component. And there, on the basis of these, we can tell where we have to intervene. So presently, what was happening that many people were doing, we took a menstrual health and hygiene session in one school. We educated about what is menstrual cycle, and we distributed pads. Did we ever ask that do you need pads? Did we ever ask that what will you do after these two pads are finished off? So that was not a solution. That was not a sustainable solution. So menstrual health index is one thing that we developed. Second is respectful menstrual care, that is a universal right for every menstruator in this world, not only females but all the persons who identify themselves as either males or females and are menstruating. So it is for them also, because we feel that we were somehow very much biased, and we used to put a lot of stigma on a trans population. So we developed respectful menstrual care also. We developed a vaginal discharge card, because many people, again, so many industries are thriving on this, that vaginal discharge is bad. Any vaginal discharge is bad without knowing whether it is physiological or pathological. So it is a very handy and visually appealing scale. And even community health workers can use it to differentiate between a physiological and a pathological vaginal discharge, especially for the young girls who keep on taking antibiotics and so many, vaginal washes, washes,
Washes and
douching. Yes,
prebiotic
unnecessary.
probiotics. So many international companies and females on LinkedIn are just writing to me that we are making these feminine products and these are good and this corrects that and this. That's why this topic was very important, Shell.
Vaginal
Yes.
washes are nowadays very in. Patient says, "Why you are not writing me a wash? That is good. The ads are there." So
On
that is
other
basic,
days.
and that does not adds to any treatment or any hygiene. Only better is soap and water, which nobody is doing, and they won't wash. And they
So,
say that the
yes,
acidity is
sorry
taken
for
care.
interrupting,
So
but yeah, you
I
can.
I had one patient. She used to have recurrent vaginal discharge, itching, recurrent vaginitis, and when once or twice I asked her, but she didn't come out. So when she became comfortable, her history. Every day she is using vaginal wash. Every day she is douching. She told me, doctor, I don't feel clean while taking bath if I don't use this. So this was one point. So I had to tell her that this is why you are having these problems, because there is something called as protective bacteria dodolins, which will help you. There's a natural protection in the reproductive tract. So if you are using so much chemicals, your natural protection is going. And once she stopped using washes, believe me, in a month or two, I treated her also. She's not come back to me. I mean, she came back after 6 months, she was fine. So I think there is a lot of misinformation in the market, and there is a lot of
It
pressure,
is
as
all
you said, commercial
MMM.
pressure
MMM.
and advertisements. People, and then peer pressure. Girls discuss, I use this watch, that was, so everyone starts using. Second thing is, what I feel is very important in villages and all, still people use cloths still. Shala, do you agree? Because of the financial constraints, right? So I remember my mother talking to me when I became a teenager, and she's from a small village on Pahalgam Road in Kashmir. And she told me that, I have used cloth when I was, young, but I don't want you to use. You use pads. She's the one who got me pads. At that time, the pads were like newly in, they were not so common, everywhere. So because I was in the city, we used pads. But the question is again the privacy part. I want to ask Shella. In villages, they have very small huts and very very negligible bathroom or an enclosed area. So isn't privacy also an issue, which menstrual health should include, like, to give privacy to the girl to change
It
during the
is
period,
there,
Stella?
respectful menstruation deals
Yeah.
with that. Yes,
It is
Shella.
absolutely necessary. And privacy is equated to dignity. She should be having a dignified approach to her menstrual safety. राइट मैम, कि अगर उसको पैड चेंज करना हो तो उसे शर्म नहीं आए, उसे ये लगे कि मैं कागज में लपेट के, और इफ आई गो टू सम प्लेस somebody sees me carrying a pad, going for changing, carrying a cloth, washing it and washing it, drying it under the sun. So that is where dignified menstruation concept seeps in. So this is what we wanted to talk about, because in our times we still were not talking about this. We still used to hide our pads. We still used to throw them in in secrecy. I will not tell it privacy, secrecy. That was an absolute, a mission to change and to dispose it of. Nobody should know that we are having menstruation, we are on our periods, and somebody should not be, seeing us. So that thing has happily changed. But as Anuradha ma'am was saying, that still in rural areas, change is, still to be brought. There is so much work to be done for these areas. It's not only about availability, it is about accessibility, it's about affordability, and it's about acceptability also. The four A's associated with dignified menstruation. So till we are, calculating onto these four A's, that is availability, accessibility, affordability, and acceptability, we are still not there, especially in rural areas. And that is where education should be talked about more, because whenever in earlier times I used to go to take sessions in slum areas, in areas where there are commercial sex workers who are, who used to call us for sessions, we were fetched away. We were like, why did you come here? We don't need you. And people will talk bad about us, that you were talking in public about menstruation. And this was not far back, like 3 to 4 years back also. If I look back, the things were like that. But yes, changes are there, they have been brought, and we are working on this, and probably all of us are working for this change.
Shala, the change is coming as the females are getting educated, and scenario is changing because of media also. Because I remember when I was young, my neighbor, I'll not disclose the few communities, that when the female get the girls get their menses, they are not even allowed to touch the pot for water. They used to sleep on the floor. They cannot use the same linen that they use for the 28 days. The linens were separate. They have to sleep on the floor, and they have to eat in the last. They cannot, matlab, they were treated like untouchables, I think 20 years back, and still in
No,
rural.
forget about Arshi. 20 years back in our families, it is still a taboo. Once we are menstruating, I'm talking about my family. Forget about living separately, but in my joint family, my parents' place, if you are menstruating, you cannot enter in the kitchen. You cannot give a glass of water to your father or brother because that is not, and you can't touch those pickles and kind of things because they think by doing that you are just making some kind of sin, or it's not good for you or for the
They
person you are
they
treating.
consider it to be impure
Impure.
because the
So
blood
this
is
is a
coming.
natural
So
process
you
which
You
cannot do,
happens.
cannot
you cannot
worship,
pray, you cannot do
you
puja, you
cannot
cannot
do
enter
any
a
kind of
temple,
worship. Yeah.
right, Seema? You can't enter
Yes.
a
So
temple,
we are
you
still
can't
there.
pray, you can't fast, you can't
So
participate in a festival
these
activity.
things will go with education. In another few years, definitely these things will change.
हाँ तो
And
इसमें
the
क्या
best
था.
part is, Shaila, I am in south of India. Here there's a separate room in my
Yes.
husband's ancestral home. There is a separate room which is away from the main house. They live in a small taluk town, and they have a big house, of course, where there are big houses you can have. So they've made one separate room for this, where everything is kept there and that's not brought into the main house, and the food is served by one of the aunts to that aunt in a different vessel. I mean, even today it's happening. Even today,
So these
Yes.
things have to be changed a lot. Still,
So
we
So,
are like.
here I
Arshi
will.
ma'am, so yeah, it was actually an ancient concept to not let the female do any work because at that times they were far better than us. They presumed that we need rest at the time of menstruation. They
Exactly.
gave us some kind of rest that don't work,
Privacy
don't
and
enter
rest.
the kitchen. Yes, you need a room, go take sleep or do whatever you want during your menstruation. But slowly and very creepily, this undignified thing that this is impure, that is why they are kept away from these things and all that stuff kept in, because it has more to do with beliefs of people rather than doing some harm to females. So dheere dheere what happened that this sort of respect for females turned out into utter disrespect and so many myths. So we are again coming back, we are bringing lot of wise people to talk about it, that yes, in our times, in ancient times, this was the practice, and it has to be brought back. So if it is acceptable that you want to work during your menstruation, it's fine. If it is not acceptable, then go ahead and take rest. And now based on these things also, now the concept of menstrual leaves has also come in. Again, we were fighting so hard that menstruation is normal and it should be accepted as a normal bodily process. Suddenly something has come, no, leaves are required during menstruation, not knowing that what can be the implication of these things. We have fought for it for last 10 years. I am fighting for this, and again we are going back to the point that absenteeism is encouraged at the time of menstruation, because there is a long term and very good study where we all should be just once in our lifetime should be looking at that study, that absenteeism during menstruation has led to low productivity on part of female gender. And we will never, we're talking of female empowerment and all that stuff, but because of this thing, because of these 5 days loss of workplace, our absenteeism from school, from workplace, we will suffer in our productivity, and thus the implications are huge for our country as well. So blindly following something saying कि yes, menstruation leave should be allowed, it should be considered normal. If you want leave, then medical leaves can be taken. So again, those concepts
Exactly.
utilized by some people for some gains, for some people but for some gains. These kinds of myths, they do creep in.
See,
Yes.
Dr.
So
Shaila, there are
bringing back
certain
to
people who have
medical,
endometriosis and they have severe
yes,
dysmenorrhea for 2 days. They need injectables. For those people, they can apply medically. We have, I think, most of us, most of the gynecologists have opposed the menstrual leave. Yeah, Dr. Seema.
yes, bringing back and this discussion towards our medical aspect of this menstrual hygiene. And you're right, life is like a full circle. कल जो गलत था आज फिर सही है. हमारे पूर्वजों ने जो किया था, मैं बहुत सारी चीजों में, be it intermittent fasting, be it menstrual leave, or so many other things, we ultimately come to realize whatever our ancestors were doing, those were great things. But in middle age, जो medieval टाइम था, उसमें उसमें बहुत सारी twist हो गए, or they became myth or wrong practices. So on this trend, one thing, Sela, always whenever I went anywhere, uh, if somebody asks me to talk about menstrual hygiene, it sounds very incomplete. We are only not going to talk about what kind of pad you should be using, where to use, and so, in fact, it should be total menstrual health. If I'm talking menstrual hygiene, as you said, I will be telling them that painful periods are not normal. And if you are not having your periods 3 days 3 months at stretch, that is not normal. If your periods are coming every 10 or 15 days, that is also abnormal. And implications of, how do you know, as your medical, this menstrual index, I came to know about it for the first time. Thanks for this, sharing this with us. And I was like bit, ज्यादा मेरे को जानकारी आ गई थोड़ी सी इसके बारे में. And what would I like to say, that it should not, we should not be just focusing on the hygiene part. As you said, it's a complete whole thing. As you made this index, it should be having different compartments. And as a gynecologist, as a medicos, we are the best people to impart this knowledge to anyone. So what is your opinion? The same way you are also doing things in your, wherever you are going in those slums, like somebody is using clothes and that person says, I'm okay, I'm fine, nothing is happening to me. How does that person know? Until unless she knows what a wrong, bad discharge is, what that itching thing is, or is she having some kind of sign and symptoms of PID. So what direction it should be taking, and how should we approach this thing, and how our own fraternity should be dealing with it.
Okay. So,
Or
ma'am,
not,
whenever, yes.
I mean, how they should interact with masses regarding these things.
Actually, Seema ma'am, when I have talked to very many gynecologists also, initially we used to conduct TOT sessions as we all do for all the subjects, the training of the trainers, because sometimes we are also not, kept abreast with the latest knowledge. We go to CMEs, we go to conferences to just brush up our knowledge. So many things are happening, and one cannot just know everything under the sun. Same goes for menstrual health and hygiene concept. There were so many things which we also came to know during the course of our interactions and working. So, as far as gynecologists are concerned, we are the best people, and I'm sure none of us need my guidance how to talk about it. Every one of us are doing it the best possible way. The only thing that is happening with majority of us is new age menstrual sanitation products. There we are somehow stuck because and why we are stuck. We should not be feeling anything shameful about it. We are stuck because it is not evidence based. We are the people of medicine. If Anuradha ma'am is prescribing some tablet, she knows what are the side effects, what are the indications, what is the dose, what is the frequency. Well, and if somebody comes to ma'am, Arshi ma'am, कि ये मुझे बता दो कि ये कैसे बनाए. So because it is not researched, because it is not evidence based, can she ever say that just go and use it because people on Instagram and on Facebook are just claiming it to be the best product? I think none of us will do. So same thing happened with us. So these new age menstrual sanitation products, be it reusable cloth pads, be it
Yes, that
menstrual
was my
cups,
next question.
yes,
That how comfortable
be it
you are and how do
I
you
am
look at it?
uncomfortable. We have researched. So that is why we were not talking about it. And that is where the gynecologist feel a bit apprehensive, or maybe, the thing that I'll be asked this question, maybe I haven't personally used, so I don't know how to use it. So a gynecologist first and foremost approach is to talk about menstrual health and hygiene. This is what happened with us. We thought that this topic for us was so normal, menstrual cycle and all that stuff, that we don't actually need to talk very loudly about it. So first is the acceptance. Second is stigmatization. As I mentioned earlier, also for everyone who is coming, even with a small query, with a smile, we are ready and we always answer. And but just this should be our protocol. Third is knowledge about normal and abnormality of menstruation, because still, however hard we say that people are becoming educated, they have good knowledge, they have access to internet, still the verified information is very less. Even on internet, verified information is very less. So we have to provide them full and authentic information regarding menstrual cycle physiology and the small abnormalities associated with that. Fourth is new age menstrual sanitation products, because we just cannot, keep this, brush this topic under the carpet. Ki kuch nahi hai. Sanitary pads are the best. We just cannot assume it. People are there. There are choices. So they will be asking. So one by one, if we dissect that these are the pros and cons of single use sanitary pads, these are the pros and cons of menstrual cups. This is how a tampon should be used, and these are the conditions where it should not be used. The concept of menstrual cup, the discharge, the virginity, the use of cups in adolescence, and regarding so many, ill effects that if people are seeing associated with menstrual cups, there the gynecologist role should come in.
We
So,
need some standardization for these pads. Some classification should be made, just as the pills are under some. There is a classification, standardization. There is nothing. It is only the brand which is marketed, and who can spend more. They are sold like this. So, what is inside the pad? What are the covering? There is no standard technique or standard way where we can come to know. Okay, yeah, this should be included in the subject, and
my
a classification should be there.
my point is, Shaila, that as you said in the beginning of your talk, that for ages our ancestors were using that cloth, and that has come in under the heading of reusable material that is not going to leave lot of footprint as pollutant on our earth. And these cotton clothes, if somebody is using and cleaning it properly, drying under sun, so is it okay for them to do it? And if they are
Yes.
using, is there any kind of instruction that this should be done, this should not be done?
Okay. So when we talk about cloth as a menstrual sanitation product, it is very good till the point that it is clean and sun dried, or it is disposed of simply. It is better than disposing of a single use sanitary product. So if you are using that much of cloth to dispose, which is a biodegradable thing, it will go off from the environment finally. So even if a girl is using a piece of cloth for her menstrual sanitation, which is clean, of course, and disposing it off, it is fine. Even if a girl is using that cloth after washing and sun drying, it is again fine. So that same cloth has been modified into for two reasons. One, for its shape. Second, for its advantage of having a proof against leakage. So if they are giving that advantage with a market made product, it is fine. But again, the problem with that reusable cloth pad is if the girls are not still not taking care of that washing part and the sun drying part, it comes back to zero from where we started. We started as Anuradha ma'am just narrated her own personal life experience that cloth nahi use karna, and she was given a pad which was considered to be a safer, better, leak proof and cleaner option. And if we are converting that thing again, that it will be a source of infection and inflammation to the girls, the point is beaten. So if the girl is using this cloth piece for sanitation, absolutely fine. If she is disposing of, let her. If she is reusing, it's just that it should be clean and sun dried and not kept under unhygienic conditions where the chances of infestations are also there.
कपड़े के
Recently,
नीचे
I
छुपा के नहीं सुखाना है.
But the
yes,
we talked about the privacy, the pers- me space for a female. So which is lacking in the village? How will this be done?
see, they are square shaped cloths. So if they are washing it and there is so-called no stain, they wash it off nicely because I have been interacting with these girls. They say कि if it is not taking a particular shape, if it is not containing a particular color or stain, it is absolutely fine. Nobody, gives an ear and eyes to that piece of cloth hanging outside.
Yes, definitely. So
So
how
you mean to say,
females are
Stella,
making
that black color cloth maybe they should use?
Nothing, ma'am. We are here to beat these practices that it is something hideous, right? They can use a pink color cloth, they can use a white color cloth, whatever they are comfortable with. We are nobody to shame them for their menstruation. So it's
But
just
Shella,
if we have
nowadays,
to.
are you educating them regarding the stuff which they can use? Because most of the cloth which is available nowadays, it is not pure cotton. It is something mixed with rayon and all. So synthetic touch is given to the cloth. So is it advisable to use this synthetic cloth?
Not at all, ma'am. Not at all. It is cotton, absorbable. Sometimes they use towel pads also. So they are intelligent enough because I think with the use of two, even if we are using it, we'll come to know that we don't have to use this particular cloth for menstrual sanitation. So it is their personal experience also which educates them, and they are using mostly cotton clothes. But the problem comes in the areas where there are slum dwellers. So it was 1 year back that I went to a slum area and I broke into tears because they were still using ash. And they were saying that whenever a bus stops by, we go there, run, we use our blades to cut those seats and take out foam from those bus seats so that we can use them as our sanitation products. So things are quite bad at certain places. There we cannot equate their situation with us or with other girls who still have access to something or the other. They are having nothing to manage their menstruation. Nothing, absolutely nothing. So whatever they find, they use it for their sanitation. There, the problem of availability and accessibility and affordability comes. So, and their acceptability is for anything and everything that comes their way. So they're asking for newspaper. The vendors, those who are passing by, they say, कि, "Bhaiya, please, एक newspaper दे दो," so that they manage their menstruation that time. So there, the things are very bad. But yes, where people are having access to something or the other, we are teaching to make the best out of what they can.
So is there any limitation on number of reusing the cloth? Is there something like that?
Okay, for reusable cloth pad, depending on how we wash it and according to manufacturer's guideline, it can be safely used for 1.5 years. Right? For 15, 16 times, it can be safely used, provided we are not soaking them for a long time in hot water. Again, that's a common practice because, Anuradha ma'am, people do feel that it is impure or hot water may, if we run it under hot water, it will get clean and all that stuff. But on the contrary, we all know that the stain will stay more if the blood is washed with hot water. It goes away only when we wash it with cold water. So
Cold
that is
water.
one instruction, yes, we give to them, that if you wash it nicely and with a mild detergent, mild soap, it will stay for 15 washes or so. Same goes for cloth pad also. We tell them that it will serve you no purpose if it is having lot of shades. So if it is all made a strain like cloth, then it will be having no purpose. So you change it, you dispose it off.
So this is about girls. Now, a married woman who is sexually active, though that is not a criteria nowadays, but that's a different part of it. Um, what about these women who can use the menstrual cup? Could you throw some light, because it's picking up in Bangalore? I have a lot of my patients who are using the menstrual cups, and they're very, very comfortable. and they have started it on their own. Go online, fix up their the diameter and all that stuff. Everything is available online. They watch some YouTube videos. There's this couple of them who told me, we watched videos and we found the cup. So can you throw light on the menstrual cup, please?
Oh, I'll throw a spotlight on menstrual cup. So, what has happened when I ventured into this area? I was doing nothing about menstrual cup except for a few case reports that I went through. कि, "अच्छा, this is not a very good thing or all that." It is an absolutely beautiful thing to use. That is one thing. Second is, even on my heavy OPD days when I have to do gynae oncology cases, I use menstrual cup because you just put it and forget it. It is so comfortable, right? Third is, regarding the size and all, we all know that vagina is a collapsed organ. Anterior and posterior vaginal walls are collapsed. They will hold anything in between those two walls. So the concept of size is not related to the size of so-called vagina. It is related to the amount of flow that one is having. So small, medium, and large cup are according to the amount of blood flow or menstrual discharge that one is having. That is point number one. Second is creation of vacuum around menstrual cup. So that is very important. If vacuum is not created, there will be spillage and the thing can come out on itself, especially if we are straining, cuffing, or having something. Third is regarding washing and hygiene part, because I'm sure these are the points where we are stuck. So we need not boil it, we need not sterilize it, we need not use any fancy items regarding these menstrual cups, because again, this has become a market. So what we have to tell our menstrual cup users, I call them cup birds, and I have a group known as Cuppamania, where people who love this menstrual cup as their sanitation product are more than welcome to join it to know more about it. So there are certain folds where we have to use them. We just have to thin out its diameter, push it inside vagina, and leave it. Once we leave it, it will create vacuum and it will stay in its place, whatever you do. Second is regarding the hygiene part that I was coming to. No boiling is required. No actual sterilization is required. No antimicrobial, antibacterial, or some deodorizers are required. No bleaching agents are required. Nothing is required. It is as simple as you put it under tap water, clean it. It is lubricated by that water. You make a C fold, you make a U fold, you make a seven fold, you insert it inside vaginal wall, you leave it there, come back, wash your hands, and be happy. And you change it after 4 to 6 hours. So
Hours.
that is the punchline. Because the problem is that Insta influencer, everyone, even the manufacturers are saying that you can, leave it for 12 hours. You cannot leave any blood product which has come out of the body for 12 hours in an anaerobic condition. It will lead to infections in an unknown proportion. So what we have to instruct them, okay, see, if even if you are a heavy menstruator, tab to you will have to do it by force. Even if you are a light menstruator, then also please take it out after 4 or 6 hours. 4 is minimum, 6 is maximum. You empty it under in the commode, again wash it, and again you can reuse it. So there
So
is no need to create hassle around cleaning of menstrual cup, because ma'am, Seema ma'am, there are so many sterilizers, फैंसी स्टेरिलाइजर्स इन द मार्केट. अब वो भी लेके हम घूमे कि मेंस्ट्रुअल कप को
oh
वी हैव
my
टू
God.
स्टेरिलाइज और व्हाट.
Shella, I
एंटीमाइक्रोबियल्स, एंटीबैक्टीरियल्स.
Shella, I was
uh,
shocked, pleasantly surprised yesterday. My son's friend, she called me. She was having some issues regarding. She was having a lot of cramps and menorrhagia. Basically, she was not able to understand because her cycles were very irregular. And she said, "Ki auntie, my cup used to fill within 4 to 6 hours. I had to change it. She is doing job, so she used to change it every 6 hours. And today, since 2 days, she has to change it every 2 hours. So she is unmarried, sexually inactive, non-active, and so I just wanted to give this message through you that this cup is equally comfortable and safe for girls who are not sexually active, and I think that is the promotion government and WHO is also doing, isn't it? And isn't it something which these slum dwellers who are looking for all these things, if we can do, that would be the best solution for them if we could provide them.
It already is. We conducted a study also that
Yeah,
uh, for people who are low on affordability should or can switch to
I
menstrual
loved
cup.
your kappa
Yeah.
mania. कॉफी वाले तो एकदम हिल गए होंगे. I loved
So
it.
yeah. So yes, it is a
Nice.
very good and affordable method, provided it is acceptable to one. So it should be acceptable to the menstruator. That's the only point.
So
And
in slums, people are accepting it.
inactive
we
doesn't matter.
we
Is
do
it?
have
So
we do
do you
have
need
a
to
point here,
demonstrate?
Ashi.
Anu,
We do
do the
have a
do?
point here. Acha, you speak.
Yes, yes, yes. You go ahead.
Speak.
What's your
Okay,
point?
Stella. We are not. We are. I mean, at least I am an era. I'm from an era where virginity was given a, a very high pedestal, chastity. Now menstrual cup has that probably issue, like, yeah, it will have. So what is probably the acceptability in unmarried girls
She want to ask whether it is very much acceptable in unmarried girls or not.
No,
We
no, no,
could
no,
Okay.
no.
discuss that.
So,
Then
how do
It
you
doesn't
counsel these
feature the
people?
mind.
That's my question. How do you counsel these unmarried girls about a menstrual cup and the implication of virginity? I want to know from you this question.
Okay. Anuradha ma'am, I never tell them to use menstrual cup. That this is the only option that you're having under the sun, right? We give them a basket choice or a cafeteria approach as we do given contraceptive agents. That is point number one. I just educate them that this is a good thing that you can use. These are the good points and these are the probable bad points of this product. So it is up to you if it is acceptable. Second thing is regarding virginity. We're not here to fight with another concept, right? We are not here ki we protect your virginity or we vouch for something that will maintain your virginity or whatever. Again, from a scientific perspective, ma'am, if we consider that total vaginal length is 7 centimeter, right? So hymen is sitting at the junction of two-third and one-third. So one-third comes to around 3 centimeters. So we have cups, small size cups, which are 2.5 and again 2 centimeters long, which can easily be inserted up till there. They don't break. See, hymen will be broken if we insert anything with force. So we teach them that you lubricate it and you put it gently inside yourself if you are comfortable. And then it is not necessarily breaking your hymen. Then again, with this concept, we teach them that, okay, hymen is not an absolute proof of virginity. It can be broken elsewise also. But we do understand this also, that this is again a concept which will take long time to, resolve and go, and probably people would like to go like forego this concept or would like to still stick on to it. So we are not there to fight for this particular concept. I just tell them that, see, you can use a small size cup. It does not break hymen if you are not inserting it with force. But then again, for adolescents, for the girls who are yet not sexually active, if anything has not gone inside their vagina, the cup will also cause a lot of problem. It will not be as pleasant as they think it to be. If they are so motivated that they are ready to use this and try this as their menstrual sanitation product, I still tell them to use a very small size cup, which will suffice for collecting the menstrual discharge and will cause minimum discomfort, not with the promise to keep their virginity intact. It is their social concepts. Virginity is actually a social concept. So if they are happy with it, okay, this is the product, you can use it. And if they're not happy, then there are other sustainable options also.
So, Shaila, it was your a show we were doing together, and the same question came to my mind. and through you only I understood the whole concept. And I think it is being written now that it does not have the capacity of rupturing the hymen, so it can be used by the girls. As you said, it will be uncomfortable, obviously, but the thing is that it is being promoted as a product which can be used by anyone, and until unless some force is being applied, it's not going to rupture your hymen. So, last thing which I wanted to know was regarding this tampon you were mentioning. So, how safe this is to use, and what is your take on this, and how do you tell? Like today, when we were about to start this session, all of us were in like dilemma that we hardly know anything about the subject. No, so just like us, many of our viewers, they are not very comfortable knowing all these and new age products, menstrual hygiene products, what all those products, what that basket is, what all it consists of. I would like you to throw a light on or a spotlight.
Okay. So I just wish that I was at my home during this session because I have that entire kit ready with me. I do demonstrate that this is the thing so that the concept is clear. I'm just outside my OT in a cafeteria sitting, just chilling out. So the new age menstrual products are many. The only point that we have to understand that we are not here to force any product on anyone because menstrual cup is so in. It is like insta influencers everywhere telling that this is so good, ye wo, and kind of stuff. Nothing like that. Menstrual cup is one of those products, right? We can have a separate session on how to use it, what are the good points, bad points, and all that stuff. Second is reusable cloth pad. It is coming with a lining with which makes it leak proof. The only point that we
Just
have
like
concern
panty
regarding pad
liners.
Third is period panty. They are again very good and safe options. The only thing that this is what I feel that menstrual discharge gets collected into the area between the natal fourchette and anal area. So that gets collected because it has nowhere to get
Yes.
dislodged. So that gives you an sort of icky feeling sometimes. Yeah. Fourth thing is tampon. So tampons were very much in my. It was there since our mother's times. It fell out of favor because it was again so comfortable to be used that people used to forget it, and it is highly absorbable. So when it is forgotten, it is acting as a foreign body, and it led to many cases of toxic shock syndrome. So when these reports of people dying because of tampons, it fell out of favor. It has again came back, but it has to be used with responsibility. As I always say, 4 to 6 hours ka bracket is the safest bracket, where anaerobic infection will also not seep in till we are keeping that product for 6 hours inside our body, right? So tampons are very good. They're inserted. Again, that concept of virginity, hymen, and all that stuff, if it is comfortable, insert it and again forget it. It is such a beautiful thing. There are two things associated with tampons. One, it can cause extreme vaginal dryness because it is highly absorbable. Second, studies have shown that if it is left for, say, more than 6 hours period, it can lead to bacterial vaginosis. So we have to educate them about the proper usage, timing, and insertion and taking out of that. Then again, the concept of labial pad is also there. There are highly absorbable pads. Those who are heavy menstruators, they can insert these pads in between the two labial folds. They don't get out as we think that they might be, just popping themselves out of the place. They are absolutely safe and very cute things to apply. So those who are heavy menstruators, those who want to sleep safely at night, they feel that they will stain themselves. They can use additional labial pads for them. In addition to this, menstrual sponges are also there. Again, that's a concept. You insert that sponge inside the vagina, it absorbs the menstrual fluid, you take it out, they're disposable also, and they're washable also. So there are two varieties, disposable and washable. Again, you squeeze the menstrual fluid out, you wash them, and you are drying them out, and they are ready to reuse them. Then there are menstrual discs also, which are modification of menstrual cups. I'll share a picture with all the esteemed,
Yes, I
experts.
wish we had this
Yeah.
decided earlier and you could have brought it, or this session should have gone home. So, yeah. Continue.
So there are menstrual discs and so many different kinds of menstrual cups that can be. These are all insertional menstrual sanitation products. So we have now insertional methods and non-insertional methods. And Arshi ma'am, as you were talking about classification, Society of Menstrual Disorders and Hygiene Management has issued guidelines for each of the product. Second, we have classified these menstrual sanitation product into the insertional methods and non-insertional methods. And again, we have highlighted all the pros and cons related to these products. And I can give the link to the website. It is there on the website also, and I'll share the document also. So the crux is whatever we are offering them. First, we have to be safe on the from the side of science. Science should have an evidence whether it is good or bad, because menstrual cup is also associated with exacerbation of stress urinary incontinence. Menstrual cup is also associated with exacerbation of milder degrees of uterovaginal prolapse. And these were the things they were not talked about. When you are professing them, you are telling them that this is the best thing in the town, market, world, universe. We are not telling them that these are the associated problems which can arise later on in your life. Would you like to switch on to a product which can cause prolapse in an already predisposed or high risk factor? So we have to see them. And for size determination, Arshi ma'am, because either Anuradha ma'am talked about it, that size determination, size is nothing, because we all know that vagina is a very good holding organ. It will keep anything inside it, provided we are not straining it out. So menstrual cup, menstrual disc, sponges, and everything, the size in this matter does not matter. It is the amount of flow which matters, whatever amount it will collect on itself.
So, Shaila, this discussion has become so interesting that we didn't realize that we are going to complete an hour. So, we'll have to say goodbye to our viewers. And this is the like a custom on this show that before leaving, we have to give our three shots. And as our special guest, it is your privilege that you should be starting with those three shots which you wanted to convey to our viewers today.
Okay, so regarding menstrual health and hygiene, it is the dignified menstruation which is more important. Second is for doctors and for community, both alike. Don't fall into the clutches of unverified internet and social media information. Anything should be backed up with science and evidence before either we as people of medicine and science are doing it, or as community who believe so much that yes, everything should be proof based. We should not be falling for anything and everything. And third thing, regarding usage, the duration of usage of any menstrual sanitation product, I mean to say any means any, 4 to 6 hours, minimum 4 hours and maximum 6 hours should be the time duration.
So that was great. Now I'll come back to Arshi and please give us your three shots.
So my first will be the moment the girl enters into the monarchy, the best friend should be the mother, and she should educate her daughter regarding menstrual hygiene and the all the available methods which she can use, and she should be the best friend of her daughter and guide her the best way and give her all the options and alternatives. This is my first shot. Second is the taboos should be removed from the society. It should not be taken under the name of religion or so. They should not work against the girl who is just growing up. So that does make a difference, because the girls, but that young soul becomes overburdened by the menses, what she's taking it as a taboo, as a difficult situation. So make it a light, it is a part and parcel of the life of a female. Third is always dry or use sunlight to disinfect your pads or undergarments. That is the most important, because still people are, what I come to know by patients is they still hang their undergarments in the bathroom itself, not in sunlight. So it is advisable through this platform. I would like to bring it. Okay, yeah, please dry your clothes in sunlight. It is a natural sterilizing agent which is abundant in India or anywhere. So my three shots over.
Dr. Anuradha.
So my three shots is, firstly, though, I should thank Shella for providing us such a good insight, really.
Yeah,
And
mazag.
my first shot is that any form of product which is used to collect the menstrual blood is acceptable. There is nothing wrong in either using a menstrual cup or a tampon or a piece of cloth, as long as we take care of and we follow the norms, as Dr. Shella said. Number one. Second, uh, I am a bit concerned about the menstrual pads. I'm a bit concerned because I am an environmentalist, and I am a very against this pollution because it's taking over our lives. So the disposing of these menstrual pads, this has to be proper. I am worried about the plastic shield which is used under the pads to prevent leakage. So probably, if we could do away without that plastic shield which is put, because the rest is cotton, unless they put something synthetic, or the sticking cover, that is full plastic. If we could have pads with pure cotton, compressed cotton, and not have anything plastic, anything which would biodegrade. So biodegradable pads, if we use and we dispose them of properly, and they get consumed by the earth, that would be the best way to do it. Third thing is, I think we are in nuclear family era. My mother and all, they have lived with, even Seema's family, 20 people in the family. Now we are in a
It's
nuclear
still like
family.
that.
They're still, I mean, even my people are still like that. So but we have come out of that, and we are in a nuclear family era, and we cannot consider it to be dirty or not do religious. Like, if I get periods and I am the only one who is doing puja, I'll go and do. So because of this nuclear family thing, I think we ourselves first have to come out of that concept which is sitting in our head, that festival can't be celebrated, this can't be done, that can't be done. That has to go away. As Arshi said, the social taboos linked with it has to go. That's my
So
three.
थैंक यू गर्ल्स फॉर ऑल दीज शॉर्ट्स। अब मैं अपने हिंदी दर्शकों के लिए कुछ जानकारियां बता दूं जो डॉक्टर शहला के पोल्स थे, जेम्स थे, जो शायद आप में से कुछ लोग पूरी तरह ना समझ पाए हों। तो हम आज बात कर रहे थे दोस्तों आपके मासिक धर्म के बारे में, और मासिक धर्म की बात जब हम करते हैं तो उसमें हमें सफाई के साथ साथ हमारे जो रेड फ्लैग्स हैं, क्या दिक्कतें हैं जो दिखाई पड़ने पे, जो होने पर आपको परेशानी हो सकती है, आपको डॉक्टर के पास जाना चाहिए। तो उसमें उन्होंने बताया कि अगर हमने ये डिस्कस किया कि अगर आपके बहुत ज़्यादा डिस्चार्ज हो रहा है, पीरियड हैवी आ रहे हैं, नहीं आ रहे हैं, ये सारी वो चीज़ें हैं जिसमें आपको डॉक्टर के पास जानी पड़ती है, जाना चाहिए। और जो सबसे इम्पोर्टेंट बात आज डॉक्टर शहला जमाल ने की, उन्होंने हमें न्यू जनरेशन मेंस्ट्रुअल हाइजीन प्रोडक्ट्स के बारे में बताया। वो प्रोडक्ट्स हैं जो हम इस्तेमाल करते हैं अपने मेंस्ट्रुअल फ्लो को कलेक्ट करने के लिए, अपने मासिक धर्म में यूज करने के लिए। आप सब, हम सब, इंडिया सबसे ज्यादा नेटवर्क यूज करता है, सोशल नेटवर्किंग प्लेटफॉर्म पे रहता है, हम सबके इंस्टाग्राम इन्फ्लुएंसर्स हैं जो फेवरेट हैं। तो आप उनकी बताई हर बात को सीरियसली लेते हुए वही ना करें जो वो बता रहे हैं। आपको इसके बारे में सबसे अच्छा आपकी बॉडी डिसाइड करेगी आपके लिए क्या अच्छा है। उसके साथ अगर आपको कुछ भी कंफ्यूजन है प्रोडक्ट के बारे में या किस तरह से हमें क्या करना चाहिए, तो आपको अपने डॉक्टर गायनेकोलॉजिस्ट से मिलना चाहिए, वो आपको सही गाइडेंस देंगे। जैसा डॉक्टर शहला ने बताया कि एक कैफेटेरिया अप्रोच की तरह है कि आपके सामने 7-8 चीजें रख दी जाती हैं और आपको सबके फायदे और नुकसान बता दिए जाते हैं और उसको आप यूज करते हैं। लेकिन उन सबसे ज्यादा जरूरी है कि हम एज अ सोसाइटी इतने मेच्योर हो जाएं कि मेंस्ट्रुएशन को एक नॉर्मल फिनोमिनन ऑफ ऑल दोज पीपल, जो लोग हैं, जो फीमेल्स हैं या जो अपने को फीमेल्स की तरह आइडेंटिफाई करते हैं, उनका एक बेसिक राइट तो अलग चीज हो गई, एक नेचुरल फिजियोलॉजिकल कि ये होता है। जैसे भूख लगती है, प्यास लगती है, आप यूरिनेशन के लिए जाते हैं, आप लैट्रिन जाते हैं, बाथरूम जाते हैं, वैसे मंथली मेंस्ट्रुएशन होता है। दैट इज वेरी नेचुरल एंड नॉर्मल। इसमें कोई शर्म की बात नहीं है, इसमें कोई टैबू की बात नहीं है, इसमें छुपाने की बात नहीं है। और अपनी सफाई जो आप रखते हैं, आप अपने सारे कपड़े आपको, अभी हमने बहुत लंबा ये सिलसिला चल गया, बहुत सारी बातें रह गई, हम डॉक्टर शैला को फिर बुलाने की कोशिश करेंगे, वो बहुत बिजी हैं उसके बावजूद भी, कि आपको सफाई रखना बहुत जरूरी है। बहुत सारे टैबूज हैं, नहाना नहीं चाहिए, ये नहीं करना चाहिए, तो आपको बेसिकली अपने को क्लीन और ड्राई रखना है, और अंडर सन अपने कपड़ों को धूप में सुखाना बिल्कुल नहीं भूलना है। और घर के पुरुषों और बड़े बुजुर्गों से ये रिक्वेस्ट है कि वो बच्चे के अंदर ये ना डालें कि अगर उसे पीरियड्स आ रहे हैं तो वो गंदी है या इम्प्योर है या वो कोई चीज इस वक्त कर नहीं सकती है। उससे उसका थोड़ा कॉन्फिडेंस कम होता है, हिलता है, शैटर होता है। और आपके आसपास कोई भी व्यक्ति ऐसा है जिसको इन प्रोडक्ट्स तक रीच नहीं है, उनको और क्या सस्ता तरीका हो सकता है, और अच्छा सुंदर सस्ता टिकाऊ तरीका हो सकता है, अगर हम में से हर व्यक्ति एक व्यक्ति को बताने लगेगा या उसकी मदद करने लगेगा, तो सोचिए डॉक्टर शहला की ये मुहिम कहाँ तक पहुंच जाएगी। ऐसे बहुत सारे लोग बहुत सारी चीजें कर रहे हैं, आप भी उसका हिस्सा बनिए, अपने आसपास एक छोटा सा चेंज लाने की कोशिश कीजिए, देखिए कितनी खुशी महसूस होती है। आज के लिए इतना ही। मैं जितना भी धन्यवाद करूं आज अपनी स्पेशल पैनलिस्ट डॉक्टर शैला जमाल का, उतना कम है। उनके बारे में और चीजें जानने के लिए, अपने मेंस्ट्रुएशन के बारे में, अपने मेंस्ट्रुअल हेल्थ के बारे में अगर आप जानना चाहते हैं, तो अभी मैं डॉक्टर शैला से रिक्वेस्ट करूंगी कि वो वेबसाइट के बारे में एक बार फिर दर्शकों को बताएं, और आप सब उनसे जुड़िए, उनकी मुहिम से जुड़िए। हम सबको जुड़ करके ऐसा बनाना है कि किसी भी लड़की को किसी बस में जा करके फोम ना निकालना पड़े, राख इकट्ठी ना करनी पड़े अपने मेंस्ट्रुएशन को हैंडल करने के लिए। आज के लिए इतना ही। थैंक यू, गुड नाइट, शब्बा खैर। स्पेशल थैंक्स टू डॉक्टर शहला, एंड thanks to my co-moderator Dr. Anuradha Khar, Arshi Iqbal. Till we meet again, take a very good care of yourself. Bye bye.
Thank you,
Thank
Dr.
you.
Seema. Thank you, Dr. Shella.
Very,
Thank you, Dr. Arshi. It
Thank
was a
you.
nice topic, a new topic for all of us, and I hope people have
well,
benefited.
it was a really a varying topic, which even we are doctors, we don't know.
और हमारे दर्शक भी इस पे बहुत कमेंट कर रहे हैं कि सिनेरियो आजकल बदल रहा है, लेकिन मैम अभी भी लोग पेपर में रख के काली पॉलिथीन में ही सैनिटरी पैड हमको डिलीवर करते
वो
हैं, तो
दुकानदार
ये
हमेशा ब्लैक पॉलिथीन में देता है। शैला, दिस इज अ नेवर एंडिंग टॉपिक एंड वी कैन टॉक फॉर आवर्स ऑन दिस। इवन दिस 1 hour is very less. You
सो
are not
अब
doing
1 घंटे
justice. We are
7
not doing
मिनट हो चुके हैं, तो हम आप सबसे विदा लेते हैं, और अगले हफ्ते फिर मिलेंगे किसी एक नए टॉपिक के साथ। तब